Insomnia disorder represents one of the most prevalent and debilitating sleep conditions affecting millions of individuals worldwide, characterized by persistent difficulty falling asleep, staying asleep, or experiencing restorative sleep despite adequate opportunity for rest. This complex sleep disorder transcends simple sleeplessness, manifesting as a chronic condition that significantly impairs daytime functioning, emotional regulation, and overall quality of life. The intricate nature of insomnia disorder involves multiple contributing factors, including psychological stress, medical conditions, environmental influences, and lifestyle choices that collectively disrupt the natural sleep-wake cycle. The pathophysiology of insomnia disorder involves dysregulation of the body's circadian rhythms, which are governed by an internal biological clock located in the suprachiasmatic nucleus of the hypothalamus. This master timekeeper coordinates various physiological processes, including hormone production, body temperature fluctuations, and neurotransmitter release, all of which play crucial roles in maintaining healthy sleep patterns. When these delicate mechanisms become disrupted, individuals experience the hallmark symptoms of insomnia disorder, including difficulty initiating sleep, frequent nocturnal awakenings, early morning awakening with inability to return to sleep, and non-restorative sleep that leaves them feeling unrefreshed upon waking. Clinical manifestations of insomnia disorder extend far beyond nighttime sleep difficulties, encompassing a wide range of daytime symptoms that significantly impact functional capacity and well-being. Individuals suffering from this condition often report persistent fatigue, cognitive impairment including difficulty concentrating and memory problems, mood disturbances such as irritability and anxiety, reduced motivation and energy levels, and increased susceptibility to errors and accidents. These daytime consequences create a vicious cycle where worry about sleep performance and its effects further exacerbates the underlying sleep disturbance, perpetuating the disorder and making recovery increasingly challenging. The etiology of insomnia disorder is multifactorial, involving a complex interplay between predisposing factors that increase vulnerability, precipitating events that trigger the onset, and perpetuating factors that maintain the condition over time. Predisposing factors include genetic susceptibility, personality traits such as perfectionism and tendency toward worry, and underlying medical or psychiatric conditions that affect sleep architecture. Precipitating events often involve acute stressors such as major life changes, relationship difficulties, work-related pressures, or traumatic experiences that initially disrupt sleep patterns. Perpetuating factors encompass maladaptive sleep habits, dysfunctional beliefs about sleep, increased arousal and hypervigilance around bedtime, and behavioral patterns that reinforce poor sleep hygiene. Psychological factors play a particularly significant role in the development and maintenance of insomnia disorder, with anxiety and depression representing the most common comorbid conditions. The relationship between insomnia and mental health is bidirectional, where sleep disturbances can precipitate or exacerbate psychological symptoms, while emotional difficulties can further disrupt sleep quality and duration. Chronic stress activates the hypothalamic pituitary adrenal axis, leading to elevated cortisol levels that interfere with natural sleep processes and maintain heightened arousal states that are incompatible with restful sleep. Medical conditions and medications can also contribute significantly to the development of insomnia disorder, creating additional challenges for diagnosis and treatment. Chronic pain conditions, respiratory disorders such as sleep apnea, gastrointestinal problems, neurological conditions, and hormonal fluctuations associated with menopause or thyroid dysfunction can all disrupt normal sleep patterns. Additionally, certain medications, including stimulants, corticosteroids, some antidepressants, and beta blockers may interfere with sleep initiation or maintenance as side effects of their therapeutic actions. Environmental and lifestyle factors represent modifiable contributors to insomnia disorder that often play crucial roles in both the development and perpetuation of sleep difficulties. Modern lifestyle patterns, including irregular sleep schedules, excessive screen time before bedtime, consumption of caffeine or alcohol, lack of physical activity, and exposure to noise or light pollution, can significantly disrupt natural circadian rhythms and impair sleep quality. The ubiquitous presence of electronic devices and artificial lighting in contemporary society has created unprecedented challenges for maintaining healthy sleep-wake cycles. Diagnosis of insomnia disorder requires comprehensive evaluation that considers both subjective reports and objective measures of sleep disturbance and functional impairment. Healthcare providers typically conduct detailed sleep histories, assess for underlying medical and psychiatric conditions, and may utilize sleep diaries or actigraphy to objectively monitor sleep patterns over extended periods. The diagnostic criteria emphasize the importance of functional impairment and distress, distinguishing clinically significant insomnia from occasional sleep difficulties that many individuals experience without substantial consequences. Treatment approaches for insomnia disorder have evolved significantly, with evidence-based interventions focusing on addressing underlying causes while promoting healthy sleep habits and cognitive behavioral changes. Cognitive behavioral therapy for insomnia, CBT-I, has emerged as the gold standard treatment, incorporating sleep restriction, stimulus control, sleep hygiene education, cognitive restructuring, and relaxation techniques to address both behavioral and psychological factors, maintaining the disorder. This comprehensive approach helps individuals develop more adaptive sleep patterns while addressing dysfunctional beliefs and behaviors that perpetuate sleep difficulties. Pharmacological interventions may be considered for short-term management or when psychotherapy alone proves insufficient, though long-term medication use requires careful consideration of potential benefits and risks. Sleep medications, including benzodiazepines, non-benzodiazepine hypnotics, and newer agents such as Orexin receptor antagonists, can provide temporary relief but may lead to tolerance, dependence, and rebound insomnia if used inappropriately. Healthcare providers must carefully weigh these considerations while developing individualized treatment plans that address specific patient needs and circumstances. The impact of untreated insomnia disorder extends beyond individual suffering, creating substantial societal and economic burdens through reduced productivity, increased healthcare utilization, and elevated risk of accidents and injuries. Research demonstrates that chronic sleep deprivation associated with insomnia disorder contributes to various health complications, including cardiovascular disease, diabetes, obesity, compromised immune function, and increased mortality risk. These far-reaching consequences underscore the importance of recognizing insomnia disorder as a serious medical condition requiring appropriate diagnosis and treatment. Prevention strategies for insomnia disorder emphasize the importance of maintaining consistent sleep schedules, creating conducive sleep environments, managing stress effectively, and adopting healthy lifestyle practices that support natural circadian rhythms. Educational initiatives aimed at promoting sleep hygiene awareness and early intervention for sleep difficulties can help prevent the progression from acute sleep disturbances to chronic insomnia disorder. By addressing risk factors proactively and implementing evidence-based treatment approaches, individuals can achieve significant improvements in sleep quality and overall well-being, breaking the cycle of sleep disruption and its associated consequences.